puts you to sleep. So let's get started. So melatonin is an endorphin hormone that is primarily synthesized by the pineal gland, and its principal role is to regulate the circadian rhythm, especially the sleep-wake cycle. It does so by signaling environmental darkness to the body, and the chemical name of melatonin is N-acetyl-5-methoxytryptamine, and its chemical structure is shown over here. Regarding biosynthesis and metabolism, melatonin has an interesting biosynthetic pathway. For starters, melatonin is synthesized from tryptophan through a four-step pathway where tryptophan is converted to 5-hydroxytryptophan through the enzyme called tryptophan hydroxylase, and the 5-hydroxytryptophan is converted into serotonin through the enzyme called aromatic amino acid decarboxylase. Then the serotonin will be converted into N-acetylserotonin through the enzyme called arylalkylamine N-acetyltransferase. And this step is the rate-limiting step. And then the N-acetylserotonin will be converted into melatonin. And the enzyme called hydroxyindole-O-methyltransferase, or HIOMT, will facilitate this process. So this is how melatonin is ultimately synthesized from tryptophan. From tryptophan to 5-hydroxytryptophan, then to serotonin, to N-acetylserotonin, and then melatonin. By the way, does this hormone sound familiar? The serotonin. Yeah. Anyways, let's move on to the regulation of synthesis of melatonin. So, this synthesis process is controlled by the suprachiasmatic nucleus of the hypothalamus. And so what happens is that with light exposure, obviously light exposure, or the light is going to travel to the retina, and the resulting optic nerve signals will make its way to the suprachiasmatic nucleus. And this is going to inhibit the pineal melatonin secretion. On the other hand, when there is darkness, this inhibition is no longer going to take place. So in other words, the pineal melatonin secretion will become disinhibited, and this is going to lead to melatonin release. And that is why in normal situation, when there's darkness, it is easier to fall asleep. So if you're trying to fall asleep while watching this video, you might as well just turn off the lights. Anyways, regarding the metabolism of melatonin, the melatonin is primarily metabolized in the liver by the CYP1A2 enzyme. And so, when it becomes metabolized, the resulting major metabolite is called the 6-hydroxymelatonin. And the 6-hydroxymelatonin will be conjugated and eventually excreted into urine. This is important to know for pharmacology purposes, or I guess I should say pharmacodynamic purposes, or pharmacokinetic purposes. Yikes. Anyways, let's talk about the circadian physiology behind the operation of melatonin. So, the melatonin secretion will typically follow a circadian rhythm. So, during daytime, its concentration will be low, but then during the evening, it will rise. And there's this thing called dim light melatonin onset just summarizes this phenomenon. And then the peak concentration of melatonin is between 2 to 4 a.m. Also, melatonin acts as a chronobiotic. In other words, it is a phase shifting agent. So, during the evening administration period, there is a phase advance, and then during the morning administration period, there's a phase delay. So, this is how the phase shifting phenomenon works behind the presence of melatonin. And melatonin does not induce sleep directly, but it can facilitate sleep onset by reducing the circadian wake signals. And so, let's break this down at a more biochemical level or physiological level. So, with melatonin receptors, you have several of them. You have the MT1 receptor, which is located in the suprachiasmatic nucleus of the hypothalamus. And then its function is to inhibit the neuronal firing and promote sleep initiation instead. And this is kind of shown over here. Then we have the MT2 receptor, or the melatonin 2 receptor. This receptor's function is to induce phase shifting circadian rhythms and also the synchronization of biological clocks. And we kind of see that over here too, where all these components are involved, or signaling pathway components are involved. And then the MT3, or the putative receptors, this time they are typically identified as quinone reductase 2, and they may play a possible antioxidant role. At the very least, this receptor in particular is less clinically established, so you don't have to know too much about this, and you can solely focus more on the significance of MT1 receptors and the MT2 receptors. So understand the difference between these two receptors, with the MT2 receptors inducing phase shifting circadian rhythms and synchronization of biological clocks. There are additional physiological roles melatonin can play in addition to inducing sleep. One of them being it can have some antioxidant effects. It works by acting as a direct free radical scavenger and also upregulates antioxidant enzymes like the superoxide dismutase. So there's some research going on about its neuroprotective effects and how melatonin could potentially be repurposed to facilitate the antioxidant and neuroprotective role. Melatonin is also known to facilitate immune modulation, so it can influence cytokine production, leading to bidirectional immunomodulatory effects. Remember that cytokines play an important signaling role in immune reactions. And then melatonin can be involved with endocrine interactions. So, interestingly, melatonin is known to inhibit the gonadotropin releasing hormone in seasonal breeders, and with the GnRH being located in your hypothalamus. And then in the humans, they play a minor modulatory role in puberty timing. So this is one potential side effect to be aware of. Let's now talk about its pharmacology. So we have endogenous forms of melatonin versus exogenous forms. Endogenous melatonin are the ones that are created in your body, and it is pulsatile and circadian. So regarding its formulations, there can be an immediate release formulation, which should be taken for sleep onset, and then extended release formulation, which is more useful for sleep maintenance. We also have synthetic melatonin agonists like Melatonin. So these are your melatonin 1 and melatonin 2 receptor agonist. It is useful for treating insomnia. We also have Melatonin, which is a non-24-hour sleep, or which can be useful for treating a non-24-hour sleep-wake disorder. And then we have agomelatine, which is an MT1 and MT2 receptor agonist, along with a 5-HT2C antagonist. And so that is why agomelatine in particular can serve as some antidepressant in some countries, or might be available in some countries, because of having an antagonistic role with 5-HT2C. So just remember that Melatonin, Melatonin, and agomelatine are some synthetic melatonin agonists available out there. Regarding its clinical applications, as we mentioned before, melatonin can be used to treat sleep disorders, like the circadian rhythm sleep-wake disorders. These arise due to delayed sleep-wake phase disorders, jet lags, or even shift work disorders. It can also be used to treat insomnia, but more of it as an adjunctive therapy and not necessarily as a first-line treatment. So just keep that in mind. It is known, melatonin is known to have neurologic and psychiatric associations. So, in Alzheimer's disease, or major depressive disorder, and even in autism spectrum disorder, there is known to be reduced melatonin secretion in the patients who have these. And then just remember that in autism spectrum disorder, the patients may have sleep dysregulation problems. And then there's also some pediatric and geriatric considerations that have to be accounted for when using melatonin. So, in general, melatonin secretion will decline with age, making it harder for elderly population to maintain a normal sleep-wake cycle. And then it can be used off-label in pediatric neurodevelopmental disorders. But be sure to use the drug cautiously due to some side effects, which we'll talk about now. So, some common adverse effects to watch out for include daytime sleepiness, headaches, dizziness, and vivid dreams. I think the most concerning ones are headache and dizziness. And then there's some endocrine concerns where there can be some possible effects on the pubertal timing and reproductive hormone suppression. But the evidence of these effects remain limited in humans, and more studies have to be conducted. And then, most importantly, watch out for drug interactions with other drugs. Because melatonin is metabolized by the CYP1A2 enzyme in the liver, if you have a drug that inhibits this enzyme, like fluvoxamine, then you're going to have increased melatonin levels because less melatonin will be metabolized by this enzyme. So, when prescribing melatonin, watch out for, or when taking or prescribing melatonin, watch out for any other drugs that the patient might be taking, like fluvoxamine. Then, studies have concluded that melatonin could affect anticoagulation. So that might be something to watch out for in the future. Anyways, there's some clinical stuff to be aware of regarding melatonin. So, if there is a tumor in the pineal gland, this can disrupt the melatonin secretion, which can then lead to sleep disturbances and possibly precocious puberty. This is probably because of the disruption of melatonin secretion, as melatonin is known to have effects on pubertal timing and induce reproductive hormone suppression. It can also be related to blindness. So, with loss of input or loss of photic input due to blindness, this can lead to free-running circadian rhythms. And then, regarding neurodegenerative disease, any altered circadian signaling can contribute to sleep fragmentation. And that's why balance in the melatonin hormone is important. So, to wrap things up, here's some key principles to take away from this video. First one being that darkness stimulates melatonin while light suppresses its release and production. The rate-limiting enzyme for melatonin synthesis is AANAT, which once again stands for arylalkylamine N-acetyltransferase. Anyways, you probably won't have to memorize that, but that's there if you want to know it. And then remember that melatonin acts on the melatonin 1 and melatonin 2 receptors, and that it specifically regulates circadian timing and not sleep drive. And then finally, it is metabolized by the CYP1A2 enzyme. So that is it for today's video regarding how melatonin works. I hope you're not sleepy by now. Or if you're really sleepy, well, that's good. Get some sleep and stay relaxed. And most importantly, stay well. So yeah, comment down below if there is some other information I missed, or if you enjoy watching these ASMR videos. I hope to make more ASMR videos soon. And feel free to like this video and share with anyone who might be interested in seeing it. Otherwise, please take care and stay well.